Assalamu alaikum class. Our today's topic is kidney disorder. In kidney disorder, we can say that our kidney is unable to perform its function. As you know, it is functioning. Its functioning is to maintain the homeostasis in your body by a process known as the by a system known as the urinary system in your body. The first thing that is made a cause in kidney disorder is the kidney stones. So, what are the kidney stones? A kidney stone is a hard crystalline material formed within the kidney or urinary tract is known as the kidney stone. Here in this diagram, you can see that this is the kidney. Inside of the pelvis cavity, here are few stones present. Stones can be made inside of the kidney or it can be made in the ureter region. So what is the composition of the kidney stones? Kidney stones can be made up of calcium oxalate, calcium and ammonium phosphate, uric acid, etc. Such things can cause the kidney stones in your body. If you take any diet that consists of this portion, it can cause a kidney stone in your body. Next are the causes of kidney stones. What can be the causes for kidney stone in your body? Here are few factors that can cause the kidney stones. Given below, the age, diet, recurring urinary tract infection, less intake of water, and alcohol consumption. These all things can cause a kidney stone in the body. Next are the kidney disorders. Symptoms. What can be the symptom for the kidney stones? Severe pain in kidney, vomiting, frequent urination, foul-smelling urine with blood and pus. Okay, here you can see in this diagram, this person is also feeling pain in the kidney, in the side and back below the ribs, pain that spreads to the lower abdomen and groin, pain that comes in waves and fluctuates in intensity, pain on urination, pink, red, or brown urine, cloudy or foul smelling urine, nausea and vomiting, persistent urge to urinate, urinating more often than usual, fever and chills if an infection is present. Next is a kidney disorders treatment. If the kidney is unable to perform its functioning, like kidney stone, how can we treat the kidney stones? Here's the treatment. One technique is given here, that is the lithotripsy. Lithotripsy is the non-electric shock waves from outside are bombarded on the stones in the urinary system. Here in this diagram, you can see these are the non-electric shock waves outside the body are bombarded inside of the kidney, and it is breaking these stones into the small pieces. Now they can easily move from this area of hilus towards the ureter. Hence, this kidney stones can be removed from the body with the help of this technique, the lithotripsy. Next are the kidney disorder in the form of renal failure. Renal means the kidney. Wherever the term renal comes, it's mean relevant to the kidney. Complete or partial failure of kidney is known as the renal failure. What can be the causes for it? Diabetes mellitus, the sugar patient, they can have easily this problem. Hypertension, drug overdoses, if somebody is taking the drugs in more quantity, then it can cause a renal failure. Okay, here you can see the polycystic kidney disease. You can see what is happening. It is actually polycystic kidney disease is a disorder where the whole kidney is infected. Here you can see these spots, these patches are present on the kidney. It is showing the renal failure, that kidney becomes completely unable to perform its function. Next symptoms, high level of urea, weight loss, swelling of legs, feet, shortness of breath. This can be the symptoms for the renal failure. Okay, here is the dialysis. What is dialysis? It means the cleaning of blood by artificial ways. When the kidney is not performing its duty, it can be done artificially by a process known as the dialysis. Okay, so dialysis of two types, in which the cleaning of blood is done by artificial ways. The first one is the peritoneal dialysis, and the second one is the hemodialysis. The first one is the peritoneal dialysis. What happened in this dialysis? How can this type of dialysis clean your blood? It is a simple way to clean the blood. What happened that a bag contains dialysis solution. Here you can see this is a bag containing the dialysis solution. It is inserting into your peritoneal cavity. Here is this in this area of abdomen. Here is the peritoneal cavity. What happened? A peritoneal catheter is inserted inside of the body in the peritoneal cavity where this solution is released. And this solution absorbs all the waste material present inside the peritoneal cavity and take it out from the body. Here you can see that it is draining out. This is the draining line from where the whole wastage is removed from the body. So this is known as the peritoneal dialysis. It can be done on regular basis. Next is the hemodialysis. Hemodialysis, you can see the patient whose kidney is infected, is having renal failure, you can say. Okay, then how the hemodialysis work? In this dialysis, what happened that the blood of the patient is taken from the body like this, and then it is passing to a dialyzer machine. Here you can see this is a dialysis machine. And here are certain channels present inside of this machine. These channels work like the kidney and they removes all the waste from the body. As the blood is passing from this region, you can see here all the waste will be absorbed. Here is again you can see students. This what is this? This is the waste material that is coming out from the dialyzer. And here is the dialysis solution that will be present here to and help to remove the waste. Next, you can see as the blood is getting clean, it will be turned back to the body. Hence, hemodialysis work. It can be done twice in a week. Okay, if a patient has done many times with dialysis and it is not working anymore, then the last one solution is the kidney transplant. How we can transplant the kidney? Simply, whenever we are transplanting any organ in human body, first of all, we just match the blood. If the donor and recipient blood matches, then we can continue the further transplantation. After doing this process, we reach towards the transplantation. Here you can see two kidneys are present inside the body of this man. But what happened, this kidney, like right diseased kidney, this is the diseased kidney, its old connection will be disconnected from here. And the new one, this is the new one kidney. You can see here, this is its all vessels are connected with this kidney. Okay, this connection is disconnected, and now here made a new connection with these blood vessels, and one connection is generated with the ureter that will remove all the waste material from the body and will move it towards the bladder. Yes, Sarah, you are raising the hand.
Miss, why this infected kidney is not removed from the body?
It doesn't cause any problem in the body, is so we can have it in our body. You can remove it as well. In certain cases, it can be removed. But if we place it inside the body, it doesn't cause any problem. Any question?
No, ma'am.
Okay. Next is the after that the waste material moves towards the bladder. Urine will stay here, and from here it moves towards urethra and eliminated from the body. This is the kidney transplantation. Okay, is it compulsory that if a kidney donor or recipient should be the relatives? Is it compulsory, students? The
I
donor?
think so, no.
No. Good answer. Okay, one thing I would like to share with you, before transplant, the tissues proteins of donor and patients are matched. That's why there is no need that either they are the relatives or not. The donor's kidney is transplanted in patient's body and is connected to the patient's blood and urinary system. And do you know that the average lifetime for a donated kidney is 10 to 15 years? When a transplant fails, the patient may be given a second kidney transplant. In this situation, the patient is treated through dialysis for some intermediary time. This is all about the kidney transplantation, and here our topic gets end.